Have you ever felt like, I don't know, just another number, lost in some huge system, maybe overlooked, or maybe you've been on the other side, desperately searching for that one critical piece of information, knowing it could change everything for someone you're trying to help? Welcome to the deep dive. We go through the sources, pull out the key insights, and, well, try to make sense of it all for you. Today, we're diving into something that really affects millions. Data fragmentation, specifically within the Veteran Affairs, the VA system. And look, this isn't just some technical glitch. It's deeply human. It impacts our veterans' well-being and also the providers working so hard to serve them. So our mission today, we're using our source material, this document called Team 108 INFO Not Data.pdf, to really unpack the cost, the real cost of having information scattered everywhere. We want to explore how maybe a smart, targeted fix could genuinely transform the whole experience of care for everyone involved. Okay, let's unpack this. The source gives us two people who really put a human face on this whole issue. Their stories, I think, paint a really vivid picture.
They really do. Let's start with Chuck. He's a 59-year-old veteran, and you can just feel his frustration. He often feels like his care team, they just don't remember important stuff, like tests he's already had done. And this happens again and again. So he's left feeling like they don't really get him or his history. Ultimately, yeah, he feels like just a number, lost. Not like a person getting care tailored to him.
And when someone feels like that, like just a number, I mean, what does that do to their trust in the whole system? Does it make them less likely to even seek help?
Oh, absolutely. It completely erodes trust. It makes that idea of continuity of care feel, well, impossible. And yes, it can definitely lead to veterans just disengaging, pulling away from the very people trying to help them. It's a real problem.
Okay, so that's Chuck's experience. Now let's flip to the other side. We have Sheila. She's a VA PACT provider, described as really dedicated, right, committed to providing that continuous care.
Exactly. But Sheila faces her own massive hurdles, mirroring Chuck's issues, but, from the provider's viewpoint.
Yeah.
Her big struggle, just waiting for community care records to show up in the system, specifically in JLV, the Joint Legacy Viewer. That's a key platform they use. These delays create this huge administrative weight on her shoulders. She literally feels stuck. Can't move forward with specialty consults, can't finalize treatment plans. Why? Because she doesn't have the full picture. The information just isn't there when she needs it.
Wow. So she's trying to connect dots, but half the dots are missing, or at least delayed. You can really feel that frustration building on both ends, can't you? It's clearly not about lack of effort from Chuck or Sheila. It's the system itself creating this bottleneck.
Precisely. It undermines everyone, the patient, the provider.
So if that's the human cost, what's the actual systemic breakdown here? What's causing this disconnect? Our source digs into this, right? It points to something bigger than just, like, occasional lost files.
That's right. The source calls it the real problem. And the scale, it's huge. Over 2.7 million veterans get at least some care out in the community. That's about 31% of all VA patients. Now, the system isn't totally broken. A good number, 82% of those community consults do have records attached when they're closed out. Scanned or electronic? And this is the absolute critical flaw, these records are scanned as images.
Images. Okay, wait. So for listeners, help us understand why that's such a big deal. Scanning as an image versus, say, searchable text, it sounds kind of subtle, but the impact must be massive.
Oh, it's massive. Because they're images, they are completely non-searchable. Think of it like this. Imagine a giant library, okay? But instead of books with text you can search, every single page is just a photograph of the page. You'd have to manually scan, visually read every single page, hundreds, maybe thousands, just to find one specific name or test result.
Okay.
I can just type in a keyword, hit find, and boom, there it is. It doesn't work that way.
That makes perfect sense. A picture of words isn't the same as the words themselves in a database, and the consequences then become really clear. Like you said, massive administrative burden for Sheila. Huge delays in making clinical decisions because the info's locked away. And ultimately, delayed specialty consults, which means delayed care for veterans like Chuck. Potentially even compromised care.
Exactly. It creates this ripple effect of inefficiency and potential risk.
And this cost, it's not just about frustration or time, is it? The source material puts some hard numbers on this. The real cost of data fragmentation. This isn't just feeling slow, it's quantifiably slowing things down.
Yeah, the numbers are pretty stark. The source cites a study, James et al. 2024, get this. Providers lose an estimated 50% of their time just searching for patient information across different systems. Half their clinical time, not spent on patient care, but on digging for files.
50%, half a provider's day just searching. For someone like Sheila, that must be incredibly demoralizing. But how does that directly hurt Chuck, beyond just making him wait longer in the waiting room?
Well, think about it. Every single minute Sheila spends hunting down a record is a minute she's not spending actually listening to Chuck. Building that rapport, understanding his concerns, it forces the interaction to be more transactional, less empathetic, less comprehensive. It's not just about the wait time. It's about feeling unheard, like your needs aren't the priority because the provider is battling the system.
Right, and that search time directly impacts decisions too, doesn't it? The study found something about OCR.
Yes. Enriching those scanned documents with OCR, that's optical character recognition, basically turning the image into actual text, it reduces that provider search time significantly. On average, it cuts the delay in decision-making from 20 minutes down to 10 minutes. So a 10-minute faster decision just by making the document searchable.
Wow. Cutting decision delay time in half? What kinds of decisions are we talking about here? Are these critical things?
Absolutely critical. Things like adjusting medications, ordering the right follow-up tests, figuring out if someone's eligible for a specific, maybe life-saving treatment. Imagine a note about a serious drug allergy is buried deep in one of those scanned images. Finding it quickly versus finding it slowly, or maybe not at all. That delay could have truly serious consequences.
Just making the existing information accessible cuts decision time in half. That's a huge lever to pull.
It really is. And then add this layer. The typical provider has to log into 3 or more different systems during just one patient visit. Every login, every different screen layout, every unique way of finding things. It's another hurdle, another minute stolen from the patient, another chance for something to get missed.
Yeah, the mental load alone must be exhausting. Switching between systems, remembering different passwords and interfaces, it's not just inefficient, it sounds like it increases the risk of errors, too.
Definitely. Cognitive load is a real factor in errors.
So every lost minute searching, it's a minute not spent with a patient, not spent on empathy, understanding, actual care. It really adds up. Okay, this sounds pretty bleak, but is there hope? What if there was a way to turn those images, those pictures of text, into real, usable information? Our source introduces a potential solution, right? Something called VA ScRIBE.
Yes, exactly. VA ScRIBE. It stands for Searchable Community Records with Index for Better Engagement.
And it's actually a pretty elegant solution to this huge problem we've been discussing. Its main job is to take those scanned documents, those images, and run OCR on them, turn them into machine-readable, searchable text. It also includes integration points, like a view alert link from CPRS, that's the main computerized patient record system, so providers can easily find and access this newly searchable info right within their usual workflow.
That makes so much sense. Using technology to unlock the information that's already technically there, just not usable. And the source talks about cost effectiveness too, which is always a factor. What was the comparison? Yeah, it's pretty striking. It estimates the cost of running the OCR technology, specifically Tesseract OCR, at about $1 per hour. Now, compare that to the estimated cost of a VA doctor's time, which the source puts at around $300 per hour.
$1 versus $300 an hour, that's not just a good return on investment financially. It's about reclaiming incredibly valuable clinical time, isn't it?
It's almost undeniable, really. The investment is tiny compared to the cost of all that wasted time. And honestly, beyond the money, you could argue it's an ethical thing. Let highly trained doctors and nurses do medicine, not, digital archaeology, digging through image files.
Okay, so let's bring it back to Chuck and Sheila. If VA ScRIBE gets implemented, what does that actually mean for them? How does it fix the problems we talked about? How does it get us back to focusing on the patient?
For Chuck, the impact could be genuinely life-changing. According to the source material, he's finally able to get the kind of care he always wanted. Comprehensive, thoughtful. Why? Because his practitioners finally have the time to listen, to really engage with him and his story. They aren't drowning in paperwork or endlessly searching for records. The source even uses this phrase that he can laugh with them again. Which, that says so much about restoring that human connection, that trust.
Wow, that phrase, laugh with them again. It's not just about efficient treatment, is it? It's about dignity, feeling seen as a person again within a system that maybe felt impersonal before.
Precisely. And for Sheila, the provider, it's just as significant. She gets her time back. More time to focus on her patients, on their actual needs, their treatment plans. Less time feeling stuck, less time buried under administrative tasks. It frees her up to be the kind of caring, effective provider she wants to be, which, also helps with burnout and job satisfaction. It's a win-win.
It really sounds like it. And the source poses that powerful, simple question. Why not try VA ScRIBE? Given everything we discussed, it feels like a pretty compelling path forward.
It does. It directly tackles a huge fundamental barrier with a solution that seems practical and, importantly, scalable.
And the benefits, they wouldn't just stop with Chuck and Sheila, right? These kinds of efficiency gains, they must have wider ripple effects across the whole system.
Oh, absolutely. We're talking potentially major, broader efficiency gains.
Mm.
That same James et al. Study quantifies this too.
Mm.
For nurses, using OCR cuts the time they spend in the electronic health record, the EHR,
Yeah.
from 25% down to 12.5%. That's a 50% reduction in EHR time for nurses.
Half. Okay.
And for physicians, it's similar. Their chart review time, it drops from 33% down to 16.5%. Again, a 50% reduction. These are described as major efficiency gains in the source, and, well, you can see why. Think about that saved time, multiplied across thousands of clinicians every single day.
A 50% cut in EHR and chart review time for both nurses and physicians. That's not just saving a few minutes here and there, that's fundamentally changing their workday. It could be huge for things like workforce retention, reducing burnout, making the whole system more resilient and sustainable long term.
Exactly right. It makes those vital roles more manageable, more focused on actual care. And what's really fascinating, I think, is how this one specific technological fix, VA ScRIBE, doesn't just save time or money. It has the potential to fundamentally improve the quality of care and, just as importantly, the whole human experience within this massive system. It's about turning that mountain of inaccessible data into useful, actionable information, putting power back into the hands of clinicians and, frankly, validating the experiences of patients like Chuck.
If this kind of approach, making information truly accessible, were adopted more widely, maybe even beyond the VA, what do you see as the potential for patient outcomes, for provider well-being across all of healthcare?
Gosh, the potential is just transformative, isn't it? It could shift healthcare from being reactive, constantly hunting for data after the fact, to being genuinely proactive, personalized. Imagine improving preventative care, managing chronic diseases better, just because the right information is available at the right time. It could even change the emotional feel of healthcare, making it feel more human-centered again, for everyone.
So we've taken quite a journey today in this deep dive. From the very real frustrations of data fragmentation, seeing it through the eyes of a veteran like Chuck and a provider like Sheila, to exploring a concrete, seemingly effective solution like VA ScRIBE. It shows how smart, relatively simple tech can unlock huge potential, not just for efficiency, but for dignity, trust, and better care.
And it really brings us to an important point. The sources we looked at wrap up with this really stark reminder. It sort of encapsulates the whole issue. Every lost minute, every misplaced record, every delay is a veteran's life at risk. We cannot wait. That's a powerful closing thought.
It really is. So, for you listening, what stands out about that urgency? About the potential impact of simply making information searchable in healthcare? Think about it. How accessible, organized, truly understood information could literally save lives and improve the well-being of those who've served. It's definitely something powerful to reflect on.